Rothbard's three dimensions of temperament were derived from caregiver reports of children between the ages of 3 and 7, and they don't exactly apply to infants. Effortful control in particular is something that starts developing relatively late in infancy, so this dimension of temperament isn't usually assessed until the age of 3 or so. Much research on infants has instead focused on a dimension of temperament that involves a combination of physiological measurements, behavioral observation, and caregiver reports. This dimension is called reactivity when measured physiologically, and behavioral inhibition when measured in terms of direct observations or caregiver reports of behavior. Physiological reactivity is typically measured by looking at the activity of the autonomic nervous system, such as heart rate, breathing, and the skin conductance response. Infants who are reactive typically have a relatively high resting heart rate, and they'll also show an exaggerated increase in heart rate to a stimulus like a loud sound. Behaviorally, infants who are physiologically reactive will tend to move and cry more in response to a loud sound, but they'll tend to be very quiet and reserved in social situations. Whereas an uninhibited child will tend to smile at a stranger or approach a new toy, an inhibited child will tend to look away from a stranger and initially ignore a new toy. You can imagine how having a strong physiological response to a person or a toy might cause you to engage in avoidance rather than approach. We don't have a perfect longitudinal study that tracks a large sample of people from infancy through adulthood. Such a study would take at least 20 years to conduct. There have been some long-term studies of temperament, but by the time the infants became adults, the way they had been assessed as infants was out of date. However, some studies have shown that infants who are physiologically reactive and behaviorally inhibited are more likely to be shy as 4-year-olds. And other studies have shown that 3-year-olds who are extremely inhibited are more likely to suffer from anxiety and depression by the age of 21. So, although the evidence is far from complete, there's good reason to believe that physiological reactivity and behavioral inhibition in infancy may ultimately be related to somebody's personality in adulthood. However, an infant's temperament doesn't completely determine later personality. Factors like parenting styles also make a difference, and especially how the characteristics of the parents match the temperament of the child. Let's think of this from the perspective of a developmental cascade. An infant starts with a specific set of genes that creates a starting place. One infant's genes may lead to high baseline heart rates and strong responses to stimuli, and another infant's genes may lead to low baseline heart rates and a less intense reaction to stimuli. These two infants are starting at different places, and they'll likely have different developmental trajectories and end up with very different personalities. Because they have different starting points, they'll likely have different experiences. An infant whose genes lead to a strong physiological reaction when an unfamiliar child approaches will be less likely to interact with that child. By contrast, an infant who is less reactive might find it easier to start playing with the other child. And these different experiences will then impact the children's further development. The way that parents react to their infants is also influenced by their infant's temperament. So, two babies who have similar parents but different temperaments will end up being parented differently. And their temperaments will also impact things like how many friends they have, whether they pursue team sports like soccer, individual sports like tennis, or no sports at all. In this way, a child's temperament influences the environment, and the environment then impacts how the child's temperament evolves into an adult personality. However, parents do have an impact. Two infants who both start with an inhibited temperament might end up in different places if they have different parents. A parent who's overly protective of a sensitive, inhibited child may end up reinforcing the child's inhibited temperament, leading to a very shy adult. Whereas a parent who's sensitive but still provides challenges may put the child on a path that leads to greater social engagement. And genes don't just impact the starting point. As we discussed earlier, a person's genotype can impact how that person reacts to positive and negative life events. As you can see, the route from an infant's temperament to an adult's personality is complex and impacted by both genes and experience. This is an area of research that's still progressing at a rapid rate, and as time goes by, we're getting a clearer and clearer picture of where personality comes from.